हेलो, मैं सब डॉक्टर आर्यन सिंह और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के कुछ इंपॉर्टेंट एमसीक्यू। A 25-year-old male intravenous drug user presents with a 3-week history of worsening lethargy and confusion. On examination, his pulse rate is 130 bpm and his blood pressure is 120 by 80 mmHg. Cardiovascular examination reveals raised JBP. Here is the important point: large V waves and loud systolic murmur, palpable pulsatile lever, and hepatojugular reflex is attempted. What types of murmur is most fitting in this patient presentation? अगर हम क्वेश्चन में देखते हैं इंपॉर्टेंट पॉइंट्स, कीवर्ड को देखना है पहले। कीवर्ड यहाँ पे क्या है? लाउड सिस्टोलिक मर्मर एंड पल्सेटाइल लीवर। हियर इज द कीवर्ड एंड इज द आंसर इज ट्राइकस्पिड रिगर्गिटेशन। ट्राइकस्पिड रिगर्गिटेशन यहाँ पे है बिकॉज द पेशेंट प्रेजेंटेशन इज इंक्लूडिंग अ लाउड सिस्टोलिक मर्मर, अ रेज्ड जेपीपी एंड द पल्सेटाइल लीवर इज द ऑल द कैरेक्टरिस्टिक्स द ट्राइकस्पिड रिगर्गिटेशन। नेक्स्ट क्वेश्चन चलते हैं। अ 45-year-old male present complaining of dyspnea on exertion, on examination narrow split H2, crescendo decrescendo murmur, ECG with LV strain pattern, echo reveals a valvular pathology. What is the following is the most likely diagnosis? Here is the crescendo and decrescendo murmur is seen in aortic stenosis. Here we can see that narrow split H2 implies aortic valve closure very late to a level that the time between the A2 and the P2 is less than the 30 millisecond. Normally aortic valve close first and then the pulmonic valve, and then the severe aortic stenosis valvular obstruction make the work of the left ventricular harder. The longer ejection time leads to the delayed closure of the aortic valve. Here is the answer because the narrow split H2 and crescendo decrescendo murmur and the main is the dyspnea on exertion is the main case of aortic stenosis. Next question. A 28-year-old man was brought to the emergency department after an episode of shortness of breath and palpitation. He had a history of fainting and lightness previously. A series of ECG were taken and shown in the image below. Here is the image. ECG, first lead, second lead, third lead, and it's the AVF. Here we can see the supraventricular tachycardia. As the main characteristics of supraventricular tachycardia is the atrial flutter. The atrial rate range around the 300 beats per minute to 200 to 400. Now we can see the AV conduction ratio governs the ventricular rate. The most common rate ratio is 2:1, with a higher degree blocks causing 3:1 or 4:1. Here is the option is atrial flutter 4:1 conduction. A ratio of 1:1 block can be occur due to the sympathetic stimulation or due to the accessory pathway. Also AV nodal agent in a patient with the WPW syndrome